Good morning. This is Today with Justin Webb and Mishal Husain. The time is now 8:45, and the pandemic has meant many big and far-reaching decisions for government and leaders of all kinds, but also for us all in our own lives. And we're going to spend the last part of this morning's programme answering as many COVID-related questions as we can. They've been sent in great numbers to our inbox in recent days.
And by popular demand, we welcome back to answer them Professor Tom Solomon, who's Director of the UK Emerging Infections Research Unit at the University of Liverpool. And we add to the team, as it were, Dr. Sarah Jarvis is also with us, who is a GP, but also Clinical Director of PatientAccess.com, the thing that connects patients to their GPs. Morning to you both.
Good morning.
Sarah, can I put the first question to you because it's from someone who has been shielding, Alison Vickers. She's in her 50s with underlying health conditions, and she says she hasn't had much advice from GPs about what she should do now. She says she's got a teenage daughter now at school. She needs to think about how to balance risks against completely isolating us all from contact. So the questions are, can her daughter mix out of school with friends in her year group bubble? Can her daughter mix with friends who are not at the same school? And can she visit friends inside their homes? All her interaction so far has been outside.
This is a really challenging one because apart from anything else, we have to start with what is the definition of shielding. All those people who were told to shield at the outset in March were told to shield on the basis of what we knew then about the virus. What we now know is that actually there are different risk factors, that some people who were told to shield, particularly young people, may not have needed to because their risks were very small, whereas other people who were not told to shield because they didn't have a single really serious health condition might be at much higher risk. What we think increases your risk is a combination of factors. The first, of course, age. We know that if you're over 65, you're 90 times more likely, over 75, 220 times more likely, over 85, 670 times more likely to die from COVID than someone under the age of 30. So if you're older and you have diabetes, which if you've got type 2 doubles your risk, if you've got type 1 increases your risk of dying by 3.5-fold, and you're of BAME origin, which at least doubles your risk, even if we take other factors into account, and you've got high blood pressure, you might be at much higher risk, even though you weren't previously told to shield, than somebody who's, say,
It shows the complexities,
younger.
doesn't it? Because there's a whole range of things that's included in that underlying health conditions term.
It does indeed. And of course, the other thing that needs to be taken into account in her case is that we've had huge problems with mental health among people who've been shielding because they've been so isolated.
Okay.
We've assumed that everyone shielding lives on their own or is of retirement age. Alison is working. She's got a teenage daughter at school. Her daughter needs a life too. So I would say unless she's in a very high-risk area, I would absolutely let her daughter socialise carefully.
And talking of needing to live your life, Jane Cohen gets in touch. She's 73, lives in Norfolk. Is it wise to book a swimming session at my local pool? I've done so, she says, but she is anxious. Tom, what do you reckon?
I think it's important to get exercise when you can. It depends a bit on the key thing is how much virus there is circulating where she lives. And people need to look at this. In the northwest, we have about 500 cases now per 100,000. In other parts of the country, it's much less. So you need to know how much virus there is circulating. Swimming pools have done everything they can to make it safe. They've reduced the number of people swimming. They've got one-way flow. So I think if she can do it, if there's not too much virus circulating, then go for it.
Tom, on a similar note, so here's another very specific question. Jill Gray, at age 80 plus, how safe would it be for me to attend my opticians for a yearly checkup or new glasses?
Again, it depends a little bit where you are, but opticians have done everything they can to make it as safe as possible. It depends also a bit on her risk factors. So as Sarah was just saying, if you're over 85, if you're overweight, if you're from a black or ethnic minority community and you have chronic illness, the risk factors are stacking up. And then you might say, well, I won't do the routine eye test, because it's not going to matter if I put that back 6 months till the summer. But if I've got an eye problem, then I will get seen.
Sarah, someone called Sue Robbins gets in touch. My husband and I live in the Yorkshire Dales. They're 68 and 71. They like to walk the hills. She asked, how much would we increase our risk of infection if we went for a strictly socially distanced hike with 4 other people from 4 other households?
So they're outside, and that's going to reduce the risk of infection significantly. Interestingly, the BMA have just come out today and said actually this rule of sixes, and I agree entirely with this, should really be a rule of 6 from 2. So you're much more likely to have a higher risk if 6 people from 6 households get together in exactly the same socially distanced manner as if 6 people from 2 households do. However, she is going to be outside, and that does greatly reduce the risk. My personal feeling is that Sue's husband and she should go out with perhaps one other couple. Now, having said that, under local restrictions, I think in the Yorkshire area, it depends where they are in Yorkshire, they might not be able to meet in a, quote, public venue. Does the great outdoors count as a public venue? It's difficult to know.
Yes, well, that's as helpful as you can be, I suppose.
Let's turn to this one from John Turner. Now that we know the young are only minimally affected by the virus, does it not make a lot of sense to rigorously shield the old but let the disease run its course in the young? The economy would benefit greatly. The epidemic would be over as quickly as possible. How to deal with those in between would need careful thought, however. What do you think? Tom?
Yes, I think this is why we've now got this national debate and this slight polarisation. At the start of the pandemic, we had no idea who would get sick and how sick they would get, and we had no treatment. We now know that for the most part, young people won't get sick, and we know that even for people who do get sick and get to hospital, we now do have treatments, and so outcomes are better. So, we are in it, if we're honest about it, that there's a national debate and there are different views. The problem with saying let it rip completely is that we know the numbers will spill from the young into the vulnerable, and we know the hospital numbers will go up, and the hospitals will get full, intensive care units will get full, and people will die who we could otherwise save. And we're beginning to head in that direction in the northwest with our intensive care units half full at the moment. And, that's what the nation has to decide. Do we want to see people dying in corridors because they can't get a hospital bed? And I don't think people do want that. And that's why we have to try and keep this disease under control.
Sarah, you did sign the letter, didn't you, from a group of GPs, which was to Matt Hancock, emphasising the need to make sure that non-COVID harms don't get lost in all of this.
Absolutely. While I agree with everything that Tom has said, we are now in a position where we have enough test and trace to know where there are problems. So, for instance, if we go back to Jane, who lives in Norfolk, her rates of infection in her area are 35 per 100,000 compared to, say, 600 per 100,000 in Manchester or Liverpool or Newcastle upon Tyne. So for her, the risk would be much lower. What we need to do is to ensure that people are getting non-COVID care, that we start to publish better data on non-COVID harms and non-COVID deaths. We had 1 million women who didn't get mammograms during lockdown. We had 75% reduction in cancer referrals. But by the same token, Tom is absolutely right. If we don't have local restrictions, then we are going to have people dying in hospital corridors.
Question from Emma. If we are to live with coronavirus in the community long term, with less affected younger people adding to increasing infection rates, won't it become more important to focus key reporting measures on hospital admissions and deaths rather than just reporting the raw infection rate itself? Tom, your thinking?
Yes, it's absolutely right that because we're now testing so many more people, the numbers of positives are much higher than they were at the height of the pandemic. But most of those people don't have symptoms, or they have very mild symptoms. So the figure to keep an eye on is the hospital admissions. That's the worrying one. But the problem is, if you wait for those to go up, it's too late. The way you know what's going to happen to your hospital admissions is from the overall circulation. And that's what we're seeing in the northwest, that as the overall circulation goes up, two or 3 weeks later, hospital cases go up, and 2 or 3 weeks after that, the deaths go up, and then it's too late.
Sarah, what's your view?
I couldn't agree more. The infection rates, the overall infection rates, are the canary in the coal mine. What we've seen in other countries, in Marseille, where they've reached in France the position where their A&Es are almost, their ITUs are almost overwhelmed, is that it started with young people, that young people then spread it to other members of their family. And that's why we've all got to accept that we all play a part. This idea of don't kill Granny, it's fine to have young people socialising together as long as they never, ever, ever go near anybody who might be vulnerable, but that just doesn't happen.
We have had quite a lot of questions on the point about the mixing across the generations, about children and grandparents. So, Tom, if you can answer a couple of them. Here's one from Susan. Please, could you tell me about the ability of 8-year-olds to transmit the virus to over 70-year-old grandparents? We are unsure as to whether to stay with them at half term. I really want to see them.
Yeah, this is a real agonising one, and I think we had one of these earlier in the week as well. So 8-year-olds can transmit it, even if they are not displaying any symptoms. And I would advise, it depends a bit where the 8-year-old is, if they're in
Somerset, so low rates of the virus.
Yeah, so rates are lower there, and so the chance of the 8-year-old being infected is lower. But if somebody in the class is positive, then that means keep away from Granny. But if nobody around has tested positive for a couple of weeks, I would say see Granny. But when you see Granny, keep it safe. So you can't have the big hugs and kisses that you used to do. But you can.
Is that no hugs? No. I mean, would you say go stay with them, don't hug? Might not be practical for people with very young children.
I know people are talking about leg hugs for little toddlers, hug Granny's leg, but she's not going to get down and pick you up and give you a big cuddle. And then also I think, once you've done your hugging, Granny then needs to go and wash her hands, just in case she happens to have picked up the virus. So it's all about doing sensible things to minimise the risk. And similarly, the 8-year-old shouldn't be sleeping in Granny's bed, because we know that does increase the risk. But if the family is staying in a hotel nearby, that would be the best option. So it's about seeing Granny, but minimising the risks when you do.
Bryony and Carl Wood write, this is Bryony writing, my husband and I recently contracted COVID. It was unpleasant, but it wasn't as bad as many have experienced. I'm 61, my husband's 74, and our positive test was the 22nd of September. Do we continue to presume that we're still as vulnerable to another bout, or can we expect some immunity through the coming winter months? Tom?
Yeah, I think there will be immunity. It would be we know there's immunity, and the question is how long that immunity lasts. It's a guess, but I think the likelihood is that somebody who's had symptoms will have fought off the virus, will have enough immunity to then see them through this season. So they're unlikely to get sick with this again, and they may be unlikely to get sick with it in future years. We just don't know yet. But most viruses, once you've been infected with it once, even if you meet it again, you don't get such severe disease. And that's why the 4 coronaviruses, which have been circulating for a long time before this recent one, just cause coughs and colds every winter, but nothing more severe than that.
Related.
Can I come back on that just a little bit? We are beginning to see cases of people being reinfected. The first one, of course, was a gentleman in Hong Kong. He'd been very severely unwell. He'd been in hospital, so you'd have expected him to have high levels of antibody, but he tested positive 3 months or so later with a slightly different strain of the virus. So he'd had the genetic fingerprint of the virus tested most times, so we knew that it was a different one. And there have been, admittedly only a handful, but about 25 people who've been studied very closely. Some of them have been more ill second time round. So the only thing I would say, while I absolutely agree with Tom that there's a good chance that there'll be some immunity, we are seeing antibodies wane within a few months. Now, there's also T cell and B cell immunity, so other parts of your immune system might help protect you even if you got that. But I think that people who have definitely had it should still not change their behaviour.
Yeah, and
if I may just come back on that.
Okay, because I have got a related question on the vaccine. Yeah, okay, go on, Tom.
I did warn you that this may happen. So that's 25 cases in 40 million people that have been infected. So, for practical purposes, it's pretty minimal. And also, the guy that was positive in Hong Kong was positive because he had a swab done at the airport as he arrived. He wasn't sick.
Yeah. Anna Fotherington wrote with a question relating to people who test positive for coronavirus, and still that means that they can be told to self-isolate again if they are a close contact, i.e. the guidance says that having had the virus isn't protection enough. And she says, therefore, can we be certain that a vaccine will protect us if that is what the current guidance states on the protection given by having had the virus once?
So if I could answer that, we are really hopeful about a vaccine. We still do not have enough people of BA-ME origin, enough healthcare workers, enough older people signing up. So please consider signing up if you are. What we will be doing in time is testing. The whole point about the vaccine testing is to test whether those antibodies, and we know all the vaccines that are being tested so far that are progressing through trials do produce what's called neutralizing antibodies. What we then need to know is whether that translates into protection against infection, and that will be the next stage of testing before the virus is released.
Tom,
before the vaccine's released.
Your view, Tom?
A successful vaccine will protect most people. No vaccine protects 100% of people, but the vaccine will protect most people, and that's why we'll use it. And I think somebody who's tested positive already, they're told to self-isolate because there is a chance of them having, if they're exposed again, there's a chance of them having it in their nose, the virus, or having it on their hands. And also it's a public health approach. We've adopted that approach. We could have a different approach, and other countries are talking about this, where you say if somebody's been positive, they get a certificate, they're now known to be safe.
Thank you both so much. Tom Solomon, Sarah Jarvis, we must do this again.
That's it from us for today, though. Our editors were Joel Moores and Ollie Stoneleigh, the studio team, Robbie Hayward and Lee Wilson. From all of us, good morning.